The fats in your blood are called lipids. Cholesterol is a type of lipid that is important for your health. To help prevent cardiovascular disease like heart attacks, strokes, and narrowing of arteries, we need to keep the right balance of fats in our blood. Everyone benefits from not smoking, eating a healthier diet, and getting more exercise. But 3 groups of people benefit most from checking and balancing the fats in their blood. People who have already had a cardiovascular event, like a heart attack, people with conditions like diabetes, angina, or kidney disease, who are at a higher risk of heart attacks or strokes, and people who have a condition called familial hypercholesterolemia, or FH. This runs in families and causes very high levels of lipids early in life. The primary prevention pathway is for people who haven't had a cardiovascular event, but are at high risk. It starts with a blood test to measure cholesterol and lipids. If you have high cholesterol, you may be able to bring the level back to normal by changing the way you live and eat, or by treating other medical conditions. For many people, this is enough. They don't need medical treatment, but if lifestyle changes don't work for you, you might need a medicine called statins. There are different types, so if one statin doesn't suit you, others may. Other drugs like ezetimibe may also be useful. The aim is to lower your cholesterol to an agreed level. You and your doctor will agree your personal target. It is helpful if you know this number. If these drugs don't suit you, or if your levels don't get to your target after 3 months, your medicines may need changing, or you may need to see a lipid specialist. If you have FH, you will often need treatment early in life, and your family should be tested too. The secondary prevention pathway for people who have already had a cardiovascular event and are at a much higher risk of it happening again. People are usually started on a high dose of a statin, like 80 milligrams of atorvastatin. If your levels don't come down, other medicines can be tried. Different tablets, ezetimibe alone or with bempedoic acid, or an injection of a PCSK9I inhibitor or inclisiran. Which medicine you take is a shared decision made with your healthcare professional. They can tell you about the different drugs and their pros and cons. You might also have a preference, like taking a tablet every day or an injection less often. Decisions about your lipid management plan are up to you. Lifestyle changes make a big difference, as can taking your medicines properly. Be honest with yourself and your doctor, nurse, or pharmacist. Make sure you're doing all you can to help them to help you.